Welcome to the podcast that puts a finger on the pulse of medicine and technology. On this show, you'll hear from investors, industry executives, and healthcare providers on the science and business of medicine. I'm your host, Omar Khateeb, and this is the State of MedTech. And we are on. So, hey everyone, Omar Khateeb, your head of state and the host of this amazing podcast with another great guest, somebody that I've been following on LinkedIn for over a year. I've learned more than I've ever learned in my life, including in medical school, no offense to my professors back then, about biologics, about orthopedics, and that's Dr. Don Buford, who's joining us from the great, emphasis on the great state of Texas, because I too am a Texan. I'm just transplanted right now in California. So Dr. Buford, thank you so much for joining us. How are you doing today?
I'm doing great, and I appreciate the opportunity to be on this show. And like you said, I'm from the great state of Texas, originally from California. We still have a little work to do in Texas, as you probably know if you follow the news, but we're getting there.
Fantastic. So Dr. Buford, a little bit about yourself, like for the audience that's just getting to know you now, tell us a little bit about yourself. Like, what's your origin story? How did you get into orthopedics? How'd you end up in Texas?
Wow. So I was one of the rare people entering medical school where I already knew really from my junior or really early in my senior year in high school, not only that I wanted to be a doctor, but that I specifically wanted to be a sports medicine orthopedic surgeon. And that came about because I was at a small private high school in North Hollywood, California, and had a chance to meet some up-and-coming sports medicine doctors that, you know, in hindsight, were all brilliant educators and leaders of the specialty and founders of many of the organizations that we all, you know well now. I just had a chance to be exposed at an early age to that kind of energy and that kind of genius. And so I went into college knowing I wanted to be a sports medicine orthopedic surgeon, which made college hard. Then I went into, medical school knowing I wanted to be a surgeon. Then I went into residency knowing I wanted, I had my path goal, my endpoint in mind. And so that was the medicine side of things. My other dream was to play professional baseball. And that dream,
really?
Yeah. And that dream came about because my father played for 10 years in the big leagues with the White Sox and with the Baltimore Orioles. Same name, so I'm a junior, and I'm the oldest of three boys, and so I took baseball as far as I could. I made it up through AA with maybe a cup of coffee on the AAA team, and maybe one split level spring training game with the big league squad. But I played a couple years in AA with the Orioles. Played a total of 4 years, and the trick of that back then was there was no internet back then. And I was in medical school at the same time. So
fantastic.
So I got
that's pretty impressive, actually.
Yeah, so I got a year and a half of medical school in between taking some years off to continue to try and advance and chase dream number one, which was baseball. And I finally decided to go back to medical school full time and graduated from UCLA and haven't really looked back. But so that makes me the black sheep of my family because my youngest brother played for 8 years in the bigs. So that's, we've got more people that played pro ball than doing this doctor stuff. But that explains my interest in sports too. I've always been athletic, always been interested in how the body heals and works and trying to keep people doing what they love to do.
Fantastic.
Trained here in Dallas at Southwestern University, UT Southwestern. Did my orthopedic residency.
Great place.
Yeah,
great
fantastic
place.
Facility. It's a county program. And as
knife fighting club on the weekend, as my dad likes to say, right?
Yeah, exactly right. So as an orthopedic guy, you get a ton of experience on the weekends. And when it's a county facility, nobody's trying to hoard cases. There's plenty to go around. And I just wanted to operate a bunch. And so I came here, loved it, went back and did a sports fellowship back with my mentor back in LA. And then I've been out here ever since 2000.
Fantastic.
Yeah.
Fantastic. And sorry for looking down. We are actually live on LinkedIn. People are signing in, which is great. And I see that number going. I love when it goes live, I start seeing that number tick up. Yeah. So I tagged you. You can reshare it later if you want.
Oh, yeah. If you tag me, that's great.
Yeah, totally. So, you have a very interesting practice. And before we kind of get into the topic of biologics and orthobiologics specifically, can you tell us just a little bit about your practice?
Yes. So my practice has gone through an interesting kind of transformation. It's kind of mirrored the rise in clinical evidence for orthobiologics. and really mirrored the rise of arthroscopy in orthopedic surgery. When I first started in 2000, I was primarily a shoulder and knee surgeon, and of the two, probably 80% shoulder, and came into Dallas and came into the field at a time when arthroscopy was really just getting started. It was still relatively controversial to do an arthroscopic rotator cuff repair, and even more controversial to do an arthroscopic shoulder stabilization procedure, where now those are relatively commonplace. And so from the very beginning of my career, in hindsight, I've always been kind of pushing the edge, with a couple good teachers behind me. I started being interested in orthobiologics somewhere around 2008, 2009. And as the research has developed, I've kind of kept my ear to the ground, knowing that biology was something that was going to be part of orthopedics, because we don't need stronger metals, we don't need stronger sutures at this point. All the anchors are pretty much just different flavors. And the biology is where we still have a chance as a specialty to make a huge impact in how things work and how people recover and minimize their pain and dysfunction. So now my practice is really, I think the 50-50 mark was about 4 years ago, and now my practice is more regenerative medicine in terms of office-based orthobiologic procedures compared to surgery. Surgery is actually less than 50%. Still busy in the
Wow.
other, but orthobiologics, I think it's a reflection, Omar, of the fact that there's so many people that won't even go see a doctor if they think the only answer is a joint replacement, or they think the only answer is a steroid shot even.
Yeah,
now
that's
that
a very
we know
good
there's
point.
an option, these people are just coming out and telling their friends that, hey, there's another option that's safe, it's cost effective, and it's in the office. And so there's a lot of people out there that we would have never known were needing or could be helped until we had an option for them.
Yeah, that's something to be said about the fact that you're a surgeon, and less than 50% of your practice is focused on procedures.
Yeah.
When did you start seeing that trend really happening, where you started focusing more on regenerative medicine?
It's interesting. It wasn't really a conscious effort on my part. I do the same types of marketing that most of us do, and my marketing was always geared towards, hey, there's other options short of arthroplasty. If you've got a joint that hurts, let us at least give you an evaluation of your options. And I've always been one to try and educate patients and people in general with what I do, not to be the decision maker for them, but to say, here's all the data. Let me answer as many questions as I can. If I don't know, I'll find out. And then you tell me what makes sense for you and your family. That really started to impact my practice makeup, again, about 5-6 years ago, where the word of mouth, if you take someone's chronic pain away or knock it down to where they can do things they could no longer do, they don't forget you, and they tell their friends about it, even more so than if you fix their shoulder, I think. So it's kind of taken on an organic growth that was unexpected. I think it's a little bit different than like a normal surgical practice growth, because there you're kind of counting on colleagues in the business, and you're counting on referral patterns and things that we've tended to lose the word of mouth referral, in my opinion, in the surgical side. But on the regenerative medicine side, that is exponentially growing.
Yeah, no, that makes a lot of sense too. Now, let's get into the most interesting topic, which is, at some point as a surgeon, and I don't want to spend too much time on this because I do want to get into like the juicier topics of the day, but like at some point as a surgeon, something struck you and you said, I'm going to go on LinkedIn and I'm going to put an effort. I'm going to spend some of my time, which is very precious, writing and educating people on LinkedIn. What exactly? Well, and my little makeshift studio just fell apart. So sorry about that, but I'll put that up. That's gonna be a great clip in this episode.
Yeah,
but yeah, no, absolutely. But at what point in your practice did you say, hey, I'm going to take to LinkedIn, I'm going to start spending more time educating people?
It really just came out of the way that I see my role as someone's doc/surgeon. And I started to see people in the office that had been told such amazing, nonsensical, ridiculous things that didn't jive with basic, high school level human biology, that it was really frustrating. And when you combine that with the fact that I was being marketed, still get marketed to as a clinician to believe a story that just doesn't make sense, even before you get to the regulatory issue, it just doesn't make biologic sense with no proof. It just became very frustrating. And I'm not one to kind of walk away from that kind of frustration when I think that it's harmful to people. And so LinkedIn was a place where I was comfortable, connecting with colleagues, and it was a nice way to correspond across distance. But it quickly, like you point out, became a way to educate. Right or wrong, I'm willing to put my name, as most of us that care strongly in this field, willing to put our name behind what we say. We're not hiding behind an email address that you can't trace, or an LLC based in some country that you can't trace. So I thought it was really important for people to know that there are people in the field that are reputable, that value their reputations, and that value their want to share what they've learned and what they've vetted, which, as you know, has required not being afraid to say that things are bad if they're bad.
Yeah, and what I admire is that, what a lot of physicians usually end up doing is they try to educate using, let's say, through their practice, which is the wrong way to market, whether you're a company or anything else, because people really are interested in hearing from other people. And so you're really the face of your practice, and you've become, for me, I can speak for myself and numerous people I've spoken to, because I ask them, do you know Don Buford? Do you know Don Buford? And everybody said, yeah, that's like my go-to source for orthobiologics. I'm like, yeah, same here. And so, I know in the last couple of months, there's some really controversial, your posts weren't controversial, but they were calling out some very controversial practices. Like, what kind of things come up that has made the world of biologics, I guess, dangerous to patients, because you're dealing with people who are in a lot of pain, they're fed up with the healthcare system. And even me, I'm kind of a good example of that. My insurance couldn't cover something recently. And so I said, you know what, I'm going to go and pay out of pocket myself and go to somebody. But fortunately for me, haven't been to med school, father's a surgeon. So I know how to research these things. And I know when to see things that are clinically valid versus things that are BS. So what were some things that kind of came up because you hit hard this past few months, and people were loving it. Yeah. Because somebody needs to call these companies out.
Well, there was a change in the landscape in June when the FDA finally said we're going to stop giving these companies slack that are knowingly violating our regulations, and so that was a real positive step in June. What's happened in the publishing business, and it's interesting because one of the criticisms is always you don't have any research, there's no publications, there's no papers. And now it's gone a step further, where now some of the papers recently, which is what I think you're getting at, that have been published in journals as reputable as JAMA, Journal of the American Medical Association, have published papers that, on the face of it, if you just read a title or an abstract, which unfortunately many of us, that's all we do. The title says PRP was used for knee arthritis, and the conclusion is it didn't work. And some people will take that and shake that around in the air and take that back. The sad thing is when it's decision makers at health insurance, companies, or decision makers at hospitals, or decision makers even in a practice that may have 6 docs, and they make a decision based on a paper where, if you actually dig into it a little bit, you can see that there's a lot of structural, procedural problems, starting with the fact that in this one I'm thinking of, they didn't even really use the product they said that they were studying. And so here's a paper that says that they're studying platelet-rich plasma, but then you've got to either buy the paper or subscribe to the journal to get the actual chart that shows that they actually injected an average platelet count that was within normal human range. So that's
not going to do anything.
It's not.
Yeah, that's like platelet normal plasma.
Right. Yeah, I'll tell you what. That one of two things. If that had worked, then I would have changed my practice and studied that and probably said, gosh, why am I doing PRP when I can just spin the blood and put in, why do PRP at all? But what that does, to me, the benefit of a paper like that, which is one of the things I wrote, was this paper proves conclusively that you should not do this. It proves how bad it is if you don't do PRP right. And so that's something that, you know, people that have a vested interest and want to bring this to people that need it, I think need to be vocal about it, because we don't want a couple of papers like that to even slide by at any point and get into the literature as not being challenged. And so it's not just me. There's many of us that will write letters to the editor. Every paper like that that's come out that I can think of in the past 3 or 4 years has had many people in the business that are thoughtful and really smart guys and girls that have written letters to the editor, taken people to task over their technique. A lot of times it really comes down to quantifying what we're doing. And so it'd be like a paper on headaches where they don't tell you how many Tylenol they gave. They just say Tylenol didn't work. And so you have so many more questions than that. And there's no reason why our research in orthobiologics and in regenerative medicine should be any different. We should be forced to quantify and identify what we're doing. We can talk a little bit about conflicts of interest and why that may be happening in this field, which is a little bit harder to suppose. But it's interesting. I just don't know how that gets past an editorial board. I think partly because they don't have the same experience with this, with this field as they would with a different type of a subject.
I think, what's interesting about these journals, and I won't name any, but the big journals that you and I talk about is that they're media companies just like everybody else. And so they're competing for dollars, both from advertisers and subscribers. And a part of this is it's a long tail game, meaning that you need more content. And so they're trying to, look at, approve, and publish more papers, in which case these things go by, because it's almost like, I feel like it's the same issues you get with prior authorizations, right? On the surface, it's like, it makes sense, right? Prior auth, it's like, oh, we need, we can't, so you need authorization for certain things. So we need another physician to authorize it. Right. But, you're not going to get, let's say, an infinite amount of, let's say, orthopedic surgeons to help with prior authorization. So a lot of times, I would bet 8 out of 10 times or 9 out of 10 times when you submit something for prior authorization and it gets rejected and you do it peer-to-peer, you're dealing with a cardiologist or a pediatrician or somebody who's a few years out of fellowship, and they're I have no idea what you're talking about. And you have to spend all this time explaining to them this new standard and why it needs to be authorized. And either you're good at negotiation and persuasion, they say, oh yeah, sure, whatever, or you're not, and then it gets escalated. And I think that's a big sign of why healthcare is the way it is. So it's not surprising that even in things that supplement and inform healthcare, like a journal, have these same kind of issues. Is that kind of off to say that way?
No, I think you're right. I think, responsible journalism is obviously the goal. I think it gets hard when you don't have a vetted expert editorial board to review the subject matter, because then who's making the decision? It's just like what you just said. The cardiologist making a decision about, a spine surgery probably isn't appropriate. And most states, Texas included, are trying to stop that practice from happening. Why wouldn't we stop a journal from publishing an article on regenerative medicine that's vetted by somebody who has no experience, has not written any articles, hasn't done any research?
Do you think one of the problems is that, again, this is not a popular opinion, but I'm going to say what a lot of people are thinking probably, which is, if you're dealing with something that messes with someone else's money, they're going to find a way to objectively and logically reason as to why that thing is not a good idea. Because it's very rare that somebody's going to say, oh yeah, this other thing's better, even though this other thing is going to directly impact how much money I make. Yeah.
You would like to not think so, but we're all human. And it is
even doctors.
Even doctors, it is what it is. And when you see some of these marketing campaigns where it says nothing about how well it works clinically because they don't have any studies, but it does say you can make $4,000 per 2 cc's, and that's the marketing campaign, they're clearly marketing to one aspect of human nature that has nothing to do with practicing medicine. And so, how the journal articles fit into that, hard to know, but, a lot of research is funded by industry, and nobody owns anybody else's blood, not legally anyway.
Yeah.
And so the fact that I can do PRP with someone and without really involving a specific drug and it's not patented and it's not on any, people can come in whenever they want to do it, it is at some level probably threatening to some industries, especially when they may have a $1 billion arthritis drug pipeline, hoping to release a drug in a couple years that affects arthritis. If they can't show that it's better than PRP, they better get PRP to go away, and make sure it's not covered. Look at what just happened with that Alzheimer's medication. It's crazy expensive, right?
Which one was that?
The one that they just approved to be covered by Medicare, as I understand it. And I think the per person cost, if you get it for a year, is something like $50,000, something like that, something extreme, to the point that they're worried about how that would impact our nation's, economy, basically, our healthcare dollar. The fact that they approved that, and we're asking them to approve PRP that costs $500, and probably, if you do the numbers, which some have done, probably every time you do PRP for someone, you're probably saving the insurance company thousands of dollars.
It's essentially preventing that patient from getting worse and going into something like, let's say, like a procedure, which involves like all kinds of overhead, facility fees, implants. Right. It's a lot of money.
Yeah, and it doesn't even have to, you don't even have to say that you're eliminating joint replacement or surgery. If you're just delaying it, the cost savings is still significant, very significant. So,
would you say, for most part, like, could this be looked at as preventative? Because maybe, another argument is to say, like, well, we wouldn't want to delay because if you delay it, the patient is older and there's higher risk, right? Could you make an argument? Could somebody make an argument like that, or no?
I think we're getting there. I think there are some studies that are very well done. One of them's done by the godfather of this, Philippe Hernegal out of France, who's got serial patient data and X-rays showing no progression of arthritis from some of these treatments, and he primarily is using bone marrow concentrate. And so we don't have enough, in my opinion, for me to counsel someone that we are preventative. I do think it's fair to say, hey, there's been several studies that have shown that, on a reasonable BMC protocol, every 3 years, 5 years, whatever the number is that you get out of the literature, that we can probably get you down the road a long stretch of time, decade or more, and your X-rays may not change. So I think the key is trying to catch those people early enough where they don't have end-stage what we call bone-on-bone arthritis. But I think ultimately the data will show that if we catch someone early when they start having symptoms and treat them with a biologic that we have some evidence is something that slows the breakdown of cartilage enough, that it will be essentially, in essence, preventative.
Got it. I want to shift gears just a bit. You recently had a post about I think placenta-based stem cell. Mm-hmm. Do you remember what I'm speaking about? Can you tell us a little bit about that? Because that seemed like a very interesting topic, and again, another area where like really unethical marketing practices were used on patients.
Yeah, in broad categories, what I tell patients at this point is if the stem cells don't come from your own body, you should at this point just walk away. Because for sure in the United States, it's not legitimate. I and many colleagues from West Coast all the way to East Coast, northern part of the country down to the southern, looked at literally dozens of these allograft birth tissue product stem cell injections, and stem cells is in big quotes because there were no stem cells. And they came from multiple different manufacturers. A lot of them were just separately labeled, but they came from the same factory. Some of them hurt a lot of people, like the Livion product, put people in the hospital at risk for their lives. And,
how did it put them in the hospital? Like, was it clot related?
Well, they were distributing infected product. And so people were getting injections that were contaminated with Enterobacter, E. coli, and getting septic. And that septic, episode was getting out of the joint that they're injected and infecting them systemically and putting them at risk. And, so this allograft birth tissue market, if you think about it conceptually, I get it. I totally get it. I would love not to have to draw blood and be able to draw 1 cc out of a bottle and have somebody do great for a year. I don't, whether you call it stem cell or not, it doesn't matter. I would love for that to exist. It does not exist right now, and it never has. And so what they capitalized on was the stem cell name, because that was sexy. Because there's research that's been done on stem cells from placenta, and all of us that have had kids have been handed brochures in the delivery room about storing the cord. But the issue is it defies human biology, because their marketing plan was to freeze that, to ship it to a doctor's office frozen. And in every single product we studied, the instructions to thaw said either just roll it in your hands for 5 minutes or put it in a warm bath for 5 to 15 minutes. And anybody that spends any time in a biology lab knows that doing that, it's not going to give you any significant living cells, even if there were living cells. And so that's just not the way that you wake cells up that have been frozen. And so people that were smarter than me, PhD types, said, look, this doesn't make any sense at all. You need to look at this. The easiest thing of all to do is just to put it on a slide and look at it under the microscope. And it even failed that test. This is a product that's supposed to have 2 to 20 million, depending on which company, stem cells per cc. And you put it on a slide, you'd expect to see a couple, and you literally see 0. So in multiple published peer-reviewed articles on this topic, there was essentially no functional stem cells found in any of those products. And people were being charged $5,000, $6,000, $7,000.
And all cash-based, right?
All cash pay. And because there's no law against it, it was being done by people across any specialty.
How is it? Yeah, and this is the crazy thing, is that when there's cash-based procedures that come out, like, it's so strange. So many, like, random physicians, like, I'm not opposed to it, but it has to make sense, you know? But, like, how is there not a law against this kind of stuff?
Well, there should be, and the problem is it's not an identified subspecialty. It's not a specialty under the American medical boards. Maybe one day it will be, maybe not. But I think most of us would agree that, at least for orthobiologics, where you're talking about orthopedics, you ought to see someone that's in an orthopedic musculoskeletal specialty, whether it's orthopedic surgery, physiatry, pain management, even family practice sports. I'm not trying to leave anyone out on purpose, but somebody that spent some time and knows how to do a proper H&P and diagnosis, because none of this works if you miss the H&P. But the lack of legal oversight is just a hole in our medical system where, once you get an MD, you can almost do anything you want. And not to mention the chiropractors, I mean, their business model to hire the nurses to do the injections is one that they blatantly advertise, make more money, add stem cell injections,
Yeah, and it's really bad too, because I think there's a lot of, for example, on the chiropractors, like, there are good chiropractors out there, but then there's a lot of like really bad ones that are doing like all kinds of stuff like this, just to like, make a lot. And I think that they don't get as much oversight as MDs because they're not always billing for insurance. So, like, the moment you go cash pay, it's just like, you can do whatever you want. Yeah.
Yeah. I mean, I've got some good friends that are chiropractors. We've got in the organization that I'm currently the president of, we have a chiropractor that's on our board who's thoughtful and evidence-based and outstanding clinician. So it's not the degree, it's that their practices, like you said, are set up to be cash-based. And I think they saw it as low-hanging fruit, because there was no invasive procedure. You're just drawing something out of a bottle and injecting it. And that apparently attracted people that could be swayed by that argument.
See, this just makes no sense to me, is that, like, physician or not, as a clinician, the moment you're pulling something out, if you're putting something foreign into somebody else's body, it's like, like me, again, I don't have my own practice, but I would be kind of freaked out and say, I really got to, like, read the literature on this, check to see what this like the whatever governing body or society says about these things, talk to some other people, etc., like, to really make sure it's valid. And I'm sure, I'm sure these people do that, but just like any other human being, once you're bought into something, you fall victim to confirmation bias, and so everything that you're looking at is just confirming a bias that you have. It's not really doing any kind of legitimate vetting of the procedure.
Yeah, you're exactly right. And most of us come through training tending to believe our sales reps And regenerative medicine was a real big eye-opening example of why you can't always do that. But you're exactly right. The confirmation bias that existed was self-perpetuating until the FDA finally said, fortunately, it was like kind of a regulatory thing that shut it down. But for me, the basic things in whatever order you want to put them, you better be able to show safety, and you better be able to show regulatory, that it's appropriate and legal. And then you better be able to show clinical efficacy, that it works better than the alternative. And so it failed on all 3 points. Those allograft orthobiologics failed on all 3 points. No clinical efficacy, it was regulatory non-compliant, and there was no safety data. So for me, it was a non-starter times three strikes.
And this thing, this specific company or this treatment, it's still being used today, correct?
Sadly, there are still places that will happily sell you that. Yeah.
And there's nothing. So just to put this in perspective, on a scale of 0 to Theranos, 0 to 10, 10 being a Theranos, like how bad is this?
It was worse until June. It's gotten a lot better. What we still see now is there are still a couple people holding onto that ledge with both fingernails, trying to, in my opinion, milk whatever they can out of this last batch they have in the closet, because they're saying that it's covered by Medicare. There's companies still making that claim that these products are covered by Medicare, and
they're not.
No, what's happened is they did an end around and got a Medicare number, basically, without getting too much into a Q code. But the problem is Medicare is not the company, not the entity that regulates drugs. The FDA is.
And I was going to say, let alone regenerative medicine.
Right. So the FDA has said and continues to say and reaffirmed it in June and continues to reaffirm it as recently as 2 weeks ago in another letter to another company, that these are not approved for any indication. And so the fact that this company just submitted stuff to the CMS people to get a Q code for billing, Q codes have no basis on regulatory appropriate, use. And so I think what we're going to see, we'll do a podcast about 6 months from now when this starts to really hit the fan, but there's going to be a massive financial clawback against people that have billed Medicare using these Q codes for products that were never regulatory compliant. I mean, millions and millions, maybe even with a B. So we'll see.
Well, I'm gonna wait to see it, but when it does, like, you'll come to mind right away. Which is I feel like every month or two, like Becker's comes out with an update. It's like these group of doctors going, and it's always around Medicare fraud for some reason.
Mm-hmm. Mm-hmm.
I don't know why that is. There a specific reason? Like, why is it always Medicare fraud? Is it just because like that's the easier one to get to just do things through? I mean, why Medicare fraud?
It is the easier one to get, and as a regulator, I think access to that data might be a little bit easier. But so for example, a Q code, like let's just say it's Q4206. That's such an easy database query into the Medicare computer to spit out every payment on that code, and now you've got your list of people to just go knock on doors and make a name for yourself, getting that money back. And the Medicare contractors who are tasked with doing these audits, they never lose because they get paid based on successful audits. So if they get on someone's tail, they're going to take that to completion and get that money back. And then that's how they stay in business. And so, you've basically got a built-in police force there. I think the other place where it's happening is in there's some district attorneys that are relatively aggressively going after some of these clinics, both on advertising grounds and on charging people cash, and some of them are being very creative in how they're charging people. There was one in California, I believe, that charged someone based on elder abuse, because the way the law was written, there's somebody who's over 65 and you knowingly cause them financial harm. And so there's creative ways to do it. The private sector tends to be more responsive, but I think with Medicare, with these audit contractors, you have to be careful. If I had been doing that consistently for years, I would be very worried now. And there's amnesty programs that they can actually take advantage of to try and minimize the fines, because the fines get tripled and sometimes even more than tripled, and it's a bankrupting type of number you usually get hit with.
Interesting. For patients, like for example, myself, I mean, I do jujitsu. Like I think I tweaked my shoulder, probably not from jujitsu. Actually, it was doing some stupid interval training stuff. But it's still tweaks. So I was like, I should like look into PRP and stuff. But like, where does a patient start? Like, where do you direct patients to get the best information? Because I don't know if I have a Don Buford here in SoCal. Maybe not. But like, where would a patient go get their information to make sure that the patient has the right information to vet these clinics out and not be taken advantage of?
Yeah, I feel for the general public that's trying to get good information, it's getting better. I think you start just with the internet, starting with, let's just say I'm in Dallas. I Google Dallas PRP providers and see who comes up. Maybe ignoring the ads, which will make Google mad at me, but going to the actual organic results where the people that have the most reviews and the most positive reviews pop up. And I would just make a short list and call 4 or 5 of them. There's a few questions, what's the doc? If you can find out from the website, that's great. If you can't find out enough about the doctor from their webpage, that's a red flag, in my opinion. A lot of these websites that are shady don't even list the provider, or if they list the provider, don't list any information. That's a big red flag. I mean, if you go to our website, it says who I am, what I've done,
Your
why
training and everything. Yeah.
Yeah. If you can't validate and verify some of that info from the website, you should at least be suspicious. But then asking questions as much as you can get on the phone or through email or what have you. But then ultimately, I would want to see somebody again who's trained in the musculoskeletal discipline, who has experience, ideally who may be published, but you don't have to be published. And if possible, knowing what I know, I would look them up on Facebook and on LinkedIn and look them up on Health Grades and try and get as many different, separate avenues of evaluation as possible. Because if someone's got good Google reviews, good Health Grades reviews, which is not linked to Google, you go to Facebook and they seem to be thoughtful. You go to LinkedIn and they've got, 3,000 followers and they're active talking about regenerative. I would be a little more comfortable seeing that person than somebody who has none of that and who's a urologist and
you're right.
No MSK experience and who I can't find anything else out about.
Yeah, no, I completely agree. And, I think, for certain things, it's okay just because, physicians are small business owners. So, your practice is going to change. Right. But it has to make sense. So like, my father trained in general surgery, surgeon of, he did general surgery for over 30 years. But at some point he started doing more varicose veins procedures. He's not a vascular surgeon, but, after getting trained on it, doing a lot of courses and everything, starting to do more cases, he converted his practice to be just a vein clinic focused on it. That makes sense. But there are other things like, I don't know, psychiatrists doing like Botox injections. Like that stuff just doesn't make sense to me. And it's kind of like, it's one thing if you change your practice, you're like, I'm going to focus on this. And it's another thing to be like, oh, like, look at all these sort of random cash-based things. Like I have like a, like a candy store, random things. You can do this, you can do that. And it just never made sense to me. And especially I think the more invasive something is, the more important it is that the physician's training is close to that. Because like, okay, someone could argue, it's like, yeah, you're just placing some injections. Like, yeah, but also when you do the H&P and evaluation of the patient, you need musculoskeletal training to know what the hell you're doing. Like, doesn't matter how great you are. Like, you can't, you need that training because there might be something very subtle in that presentation that you catch, and then you say, this patient's actually not a good candidate for PRP. They actually need surgery or they need something else, right? Versus like a random physician just be like, hey, yeah, like just sit up here. Like, let's just inject you and get on with it.
Yeah, no, and that's the danger when the procedure is made super easy, where you just draw something out of a bottle.
Maybe that's where this bad behavior comes from. Is that I bet you know what, we should put this on a graph. The easier the procedure is to do, and the more cash is paid out, you're going to end up with bad behavior. I think that's a good heuristic.
Yeah, and you're going to see with that procedure, you're going to have more specialties involved. You mentioned psychiatry, which made me laugh because there was a psychiatrist in the San Fernando Valley who was a regenerative medicine expert.
Are you kidding? You got to be kidding me.
No, and the only thing that a lot of those clinics have in common, The only thing a lot of those clinics have in common is all their procedures are cash pay across, if they have a new cash pay procedure, they add it. So, but yeah, you're right. It's a cash attracts people that like cash, and they're not always people that have taken the Hippocratic Oath and people that are ethical, unfortunately. But I think that's changed for the better, and it's continuing to move in a direction like a true scientific discipline should.
Yeah, no, absolutely. And I think the exciting thing, and maybe I think COVID did a lot of things, like in terms of accelerating trends that were already there. But I think, and maybe because I'm exposed to it a little bit more because I'm in SoCal, I think this area of medicine, when it comes to like regenerative medicine, longevity, I think more and more people are getting interested in that, myself included, where people are more interested to spend cash up front to do these kind of things that are going to like extend longevity, improve things, regenerate things, versus kind of going through the traditional healthcare system, and you end up paying more or less like the same amount, and things that just end up being a lot worse. So I think there's a lot of really exciting things in this space. But again, like when it's cash based, like there's a lot of like bad players involved, and as long as there's people like you calling these people out like by name, company and individual in public, like I love it, and I think that's what needs to happen. I think that's what needs to happen.
I think it's a conversation we have to have. And most of the time, I'm just asking for explanation. Like, hey, this doesn't make any sense to me, and if I'm ignorant, my apologies, and educate me on it, because I am not one to claim I know everything about everything. There's way too much to know, but there are some things, as you know, that just defy common sense, that deserve to be held up to the light of day.
Don't go to a psychiatrist for PRP, guys. Unless
they can show that they've shadowed somebody, they've gone through the IOF's the interventional orthobiologics. They've gone through the IOF curriculum. They show some change that makes sense that you can track. Then maybe, but you're right. It's got to be logical.
Yeah, no, it really does. It really does. Well, Dr. Buford, we won't be mindful of your time, but as we wrap up, we just do this kind of fun, quick, rapid fire question. We've got a couple of questions for you. You can answer them as quickly as you want. But it's kind of a fun way to kind of wrap up the show. And again, thank you so much for coming on, sharing your knowledge. You're going to be my go-to orthobiologics correspondent. So I'm looking forward to having you back, because I think once 2022 rolls around, we're going to see some really big stories in the news. So we're going to definitely want to have you back for updates. But yeah, so first rapid fire question for you. So during the pandemic, we bought a lot of interesting stuff for ourselves, books, gadgets, etc. And I had to adjust the price on this. I used to say $100, but some people got things that are over it. But what's something that is less than $200 that you bought during the pandemic that you love? It could be a book, it could be a gadget. What's something interesting you bought?
Well, I'm a gadget guy. I am a hardcore gadget guy. So it's going to have to be a gadget. And sadly, it's probably this microphone I'm talking to you on. I got the nicest Yeti, which is probably
a nice more.
Yeah, but so I loved that, and like most of us, when the gym's closed, I had to outfit my house, so I didn't get to be up north of 300 pounds. So I've got some toys up there that I bought that allow me to stay home and work out too. And so those, between the stuff for the Zooming and this, yeah.
I'm right there with you. I mean, I used to go to the gym all the time, and then my wife went to her own gym. During the pandemic, we started with a couple of kettlebells. 6 months into it, we really loved like working out together.
Yeah.
I got a whole garage gym, squat rack, everything. And it makes, I'm never going back, because now every day I work out, even if it's just going and like picking some stuff up for like 10 minutes.
Yeah.
Like, I'm jacked right now. I've gotten in such immaculate shape. So like garage gym, such a great investment.
Well, you look down at your Apple Watch and that red ring. You only got to get another little 50 calories. You got to figure out what to do.
Yeah, that's exactly right. And then when it's right there, there's no excuses.
Yeah.
So a couple more questions for you then. So part of medicine, continuing education is a big part of medicine. But the one thing I love about the culture of medicine is that it goes beyond just the art of medicine and science. It goes to other things. What's a book that you've read in the last year or so that you feel like you've recommended and gifted most often to people?
Oh, wow. So I tend to escape on my long drives into the office into things that aren't medical, if that counts.
No, that's 100%. That's exactly what I was looking for.
Okay.
Yes.
So, and because I respect so many of my colleagues that have served in the military, I listen to a lot of books along those lines. You know, with the Vince Flynn authors and the people that you would recognize. And so that helps just take my mind completely, kind of clear the decks and allow me to disappear into what for me is a fantasy world. And I try and, I've got a couple partners in the office where we talk about the latest thing that we're listening to or reading, and it's usually along those lines. Yeah.
Nice. Fantastic. All right. So the last question for you is, I want you to pretend that I'm going to take a billboard out for the next year. And this billboard is going to go in front of every single doctor's office throughout the country that does biologics. Okay. They're going to see this message. What message do you put on that billboard?
Wow. That's a great question. It's got to be, it's got to be almost a motto or a credo, if that makes sense. Something along the lines of, you need to be thoughtful when you're doing orthobiologics. And so gosh, how would I word it? Evidence-based orthobiologics. Oh gosh, I'd have to think about it. I'm going to have an answer for you.
We'll hold you to it. I'll look for it on LinkedIn. Who knows? This question might just create your new tagline.
That's it. We'll set up, as much as I struggle with LinkedIn polls, we'll set up a poll.
Yeah, there you go. Yeah, set up a poll. I'm looking forward to seeing it. Awesome. Well, Dr. Buford, stay on for a few minutes. We'll chat real quick. But hey, everyone. Okay. Don Buford, MD, please make sure to follow him on LinkedIn. I'm going to drop some links below in the notes. That way you can follow him, check out his practice. I'm Omar Khateeb, your host and head of state at the State of MedTech, and we'll see you all next time. Bye for now. Hold on one sec.